Today we're going to talk about an interesting case. A young gentleman was referred to my office by an oral and maxillofacial surgeon requiring comprehensive care. This particular case required orthodontics, oral surgery, and prosthodontic care to achieve an excellent result. Initially, the patient was missing teeth 1-3, 2-3, and 2-4. Conical teeth were noted on the 1-2 and 2-2, as well as the 1-1 and 2-1. So it's a bit of a spacing issue. And on top of that, the patient had a class 3 malocclusion, which means the upper jaw is further back from the lower jaw, requiring a LeFort I surgery to correct. As we take a closer look here, the lateral incisors 1-2 and 2-2 are narrow in shape. And in general, with teeth like that, they can create what's called a Bolton discrepancy, which makes orthodontic alignment of the teeth difficult. So oftentimes we do either composite buildups or crown restorations to improve the aesthetics and the size of the tooth. You can see here the 1-1 and 2-1 are also narrow in size, and in this particular case we decided to use 3/4 crown restorations to restore them as well. Over here you can see that once orthodontic treatment was completed, we have adequate space here for the restoration of the edentulous area with the 1-3 implant and implant crown, achieving an excellent and seamless result. On the left side, it's a little bit more complicated. You can see that there is a significant tissue and bone defect at the site of the 2-3 and 2-4. While we considered implants in this region, if you notice, due to the defect, the implants would have to be placed significantly higher, which may result in difficulty cleaning as well as a poor aesthetic result. Instead, the oral surgeon did a soft tissue graft to enhance the soft tissue, and then we fabricated the bridge to provide a better aesthetic result that's easier to clean. So what we ended up doing in this case is we did crown restorations on teeth 1-2, 1-1, 2-1, and 2-2. We replaced the missing 1-3 with a dental implant, and the 2-3 and 2-4 with a bridge from the 2-2 to the 2-5. As a prosthodontist, it's important to treatment plan 20, 30, 40 years down the road to ensure that we can always provide our patients with the best treatment outcomes and function. Comprehensive treatment plans require several years to complete and involve multiple specialists. For me personally, these are some of the most rewarding yet challenging cases that we complete. In this particular case, I believe we were able to achieve an ideal aesthetic result. Let me know in the comments below what you guys think. Thanks for watching.